Good morning. My name is Janet Thurston. This presentation has been prepared for the Frontier Nursing University course PC 711, Nurse as Educator. This course is of interest to me. One of my professional goals is to return to the role of faculty in nursing education. The instructional methodology I will describe is implementation of the flipped classroom. The goal of this presentation is to achieve understanding of the concept of the flipped classroom. This methodology, according to Bergman and Sam, involves a combination of learning theories of constructive philosophies and behaviorist principles. The objectives are to conceptualize the implementation of the flipped classroom design and to promote student engagement in the learning processes. This often involves web-based learning, which can be efficient and cost-effective. What is the flipped classroom? It begins with curriculum development, then implementation of it. As a pedagogical model, it begins by having typical lectures happen outside of the classroom. The reading assignments are provided with online lectures. This is followed by classroom time, which is student-centered. Activities occur with the instructor acting in a supportive role of in-class learning assignments, which may be including preceptorship, hands-on learning, such as the simulation laboratory would exist. An ACLS class may be an example of this. Prepare for hands-on learning and demonstration of competency in clinical performance. Why is there a need for the flipped classroom methodology? Time efficiency, effectiveness, as this involves all self-directed adult learning, followed by group interactive activities associated with the curriculum. This enhances learning experiences according to the literature. Who is doing this? There is a growing number of higher education faculty implementing this type of education. It is also being done effectively in adult healthcare education, such as in medical education. It is being done during EHR implementation, where simulation lab students prepare for clinical curriculum learning. One of the most significant examples is within Stanford University's medical school. Many educational systems are adopting this methodology according to the literature. See the website reference posted in the notes. I recently participated in the Stanford Medical Education course titled Patient Engagement Design, which can be accessed without cost. It provided the students with opportunities to interact with hundreds of other experts from many professionals on this topic. The elements of the true flipped classroom methodology was utilized in this course. The reference link is posted. This literature review begins with reflection of the history of sharing information at low cost via technology. The history of sharing information began long ago. In the 1400s, the printing press was developed, and then by the 1830s was the electronic telegraph. By 1900, wireless radio emerged. From the 20s to the 40s, television and computers came into society as we moved into the technology age. From 1960 to 1990, Internet and the World Wide Web began and continue to grow today. It's hard to imagine where technology will take us in 20 years or how it can transform education and healthcare. Free access to information has expanded immensely. Encyclopedias have gone from Britannica to Wikipedia, then on to the development of better foundations of reference, which are reliable. This includes the creation of the Khan Academy in 2006. The use of Khan Academy courses and Coursera courses have engaged over 300,000 students in one course or more who access the Internet and the content from the regions all over the world. The primary language used is often English. Leading universities have immense fees, such as Case Western Reserve University, and they may offer learning which is credible, taught by experts as non-college credit, offering very valuable learning. I have participated in a course from Case Western University on quality improvement taught by my previous professor, Shirley Moore. Consider that full-time registration for coursework there is now $70,000 per semester. Despite the fact that I received no college credit, I accessed nursing leadership and education. The flipped classroom for me is to listen to their lectures, then participate in the activities assigned through peer activity and review, and more so to apply this knowledge in my clinical environment. This course was the first quality improvement course created in the United States. For more information, see the link posted in the notes. This is a photograph of the Nampa Frontier University nurse practitioner students. As a graduate of CNEP in class 11, almost 20 years ago, the statement made is true. How things have changed. I was the first nurse midwife in Fairbanks, and now 10 are practicing there, and everyone is grateful. There are now 2 birth centers there with 90% breastfeeding rates. This is what education can do, and you are all part of it. Why then should we use the flipped classroom methodology? Because it improves outcomes. It can greatly increase the motivation for learning because students are working with additional support, collaboration, with one-on-one practice for complex ideas that need further explanation, according to the literature. The scores of knowledge increase with improved experiences in learning. There's improved critical thinking that has been noted in the literature. And there's one study that relates to this in graduate nursing education, which provides evidence that the flipped classroom results in overwhelming success for students and for faculty. Why has the flipped classroom been so successful? It is a self-directed, collaborative learning experience with social interactions. The varied instructions may help offer a variety of diverse learning methodologies, such as visual, auditory, followed by hands-on tactile active learning. It may be helpful to offer time flexibility, ease of access, and cost containment. It requires preparation, time, and effort to create and update this type of technology, and this can apply to the faculty and the students. Frontier Nursing University certainly can. As we imagine the future of technology development and future predictions that have been made, it is known that the redesign of the classrooms may be required when students move from lecture auditoriums into simulation lab environments. Mobile application and device tools are being developed for some courses, and likely these smartphone-type applications will grow in overall education. The implications for this is to know the responsibility for learning does belong to the student. For more focus on hands-on learning is the clinical laboratory simulation in medical and nursing practice, and we are moving from lecture learning as novice into mastery and expertise in practice more quickly. Flipping the classroom is more about a mindset, they say, redirecting attention away from the teacher and putting attention on the learner and the learning, says the literature. To bring together or to synthesize the concept of a flipped classroom methodology is to bring it into one emphasis that the classroom is an application and learning, not memorization of facts. The pedagogical method or model of inverted traditional education may involve the online pre-recorded lectures, discussion boards, and implementing readings prior to class. The students come to class prepared for group discussion, interactive case scenarios, demonstration, and return demonstration challenges. The flipped classroom methodology represents a unique combination of learning theories as previously described. These theories were once thought to be incompatible. Active and problem-based learning activities founded on this constructivist ideology and the instructional lectures derived from direct instruction methods founded on behaviorist principles did not seem to be combined. But when healthcare education flipped classrooms, as described, it is within the adult education framework of self-directed learning. The meta-synthesis of research reviewed in this method has had the implementation of both these theories. The flipped classroom has expanded the learning environment from a classroom into the community. And the classroom moves out to the community then moves into the classroom. The distance and traditional education are combined. I'm posting this slide just to show it as a good example of inversion of a traditional classroom setting or what happens on site in the classroom. Imagine the methodology of traditional learning in the past that you may have experienced, what students have experienced beginning in grade school, and what they may be experiencing now. In discussion of appropriate use of methodology for instruction of population or audience, I have considered the flipped classroom methodology to healthcare provider education. As a student from the pre-technical age, I see young children using small laptops playing games. It seems true that they are being raised in technology. Their understanding of text messaging has surpassed mine. It's easy to see why they can be called millennial students who are less tolerant of lecture-based learning. In terms of healthcare provider learning, providers who are adapting to, for example, the new EHR technology don't have time to schedule long lectures. They find it more effective to fit learning into their schedules, this self-directed process in the experience, followed by hands-on preceptorship. This is implementation of a flipped classroom methodology in healthcare education, and it is happening all over. Other multidisciplinary educational settings are also adopting this methodology. The incorporation of Khan Academy lectures in high school mathematics is an example. Grade schools and university settings have incorporated this into curriculum implementation. At a recent meeting I attended, it was stated by others that this has been implemented in the native high schools in Montana, leading to improved success for university settings. As we seek to improve diversity in the population of the practicing nurses, this is an important concept to keep in mind for the future of nursing. In regards to the methods of evaluation, I have offered three different concepts. First is the rationale for the evaluation suggested. This is repeating a previous study done, which provided information on the successfully learned flipped classroom environment setting with public health students. The study noted in 2013 that there was a cohort of public health students participating in the flipped environment in occupational health courses. Evaluation resulted in students reporting that they had an increase in knowledge. Data revealed positive learning experiences and perceptions of the flipped classroom model. Students rated their course experience more highly and reported positive learning experiences in an increase of self-perceived knowledge. Much of this was in qualitative data collected. Student evaluation of the course should be considered from a focus group information gathered. To evaluate learning experiences from a greater perception, it is good to gather data to compare to other studies and other populations to compare the results among settings. That would be done in comparing test scores in the course from pre and post course, or to compare tests of the flipped classroom versus the standard traditional classroom. When evaluating the flipped classroom methodology, quantitative and qualitative data can be combined to investigate if learning outcomes and experiences improve. It would be beneficial to investigate this outcome of learning, particularly in graduated nursing education, because more information is needed on this topic. There's very little information where this is occurring in healthcare. So evaluating its outcome or benefit, according to Kritz and Knight, is needed. There are settings such as simulation labs where this might occur, and the focus on graduation nursing education would be beneficial. In conclusion of this presentation, this is a photograph of a Frontier Nursing student and student educator, and I can't say which is which. So I would just say that what inverted classrooms may be flipping is not just the classroom, but the entire paradigm of teaching. In systems of educational change, nurse educators continue to measure the evidence of their improvement. Frontier Nursing University has been an example of this for the past 75 years, having celebrated their anniversary recently. Today, community-based learning continues to grow.